All right, so we are going to be doing a couple different skills today in the skills lab. We're going to be doing adding stuff to a sterile field, so it's our sterile water. We're going to be suctioning, sterilely suctioning, and then also we're going to be doing trach care on our patients. The supplies that we'll need is you'll need your suction catheter kit, extra sterile gloves if you don't wear the ones inside the kit. You'll need a fresh inner cannula. Also, you'll need a bottle of sterile water, goggles, face mask because you don't want to be suctioning someone without any type of protection. Also, you'll need a blue pad to go on their chest, a new trach tie, a 4x4 dren sponge, and also some Q-tips to clean around the stoma site. So this is all of the supplies that you're going to need in order to do the skill that we are going to be doing tomorrow. All right, so the first thing I've done, I've checked all my orders, I've gathered all my supplies. I'm going into the room, so I'm knocking. Hand hygiene. Hi, my name is Casey. I'm going to be your nurse today. Today I'm going to be providing trach suctioning and also trach care. Before we get started, can you please tell me your name and date of birth? Thank you. Do you have any allergies I need to be aware of? Okay. All right, so what I'm doing right now, I'm going to provide privacy, pull the curtain. So I'm going to elevate the head of the bed. So whenever we are suctioning someone, we will make sure that we're setting them up to suction and to do trach care. Making sure we maintain safety at all times with our patients. Okay. Before we get everything set up, I want to make sure that I have everything working. So I'm going to go ahead and I'm going to lower this side of the bed. That side is still up. My patient has a trach that is midline. It looks really good. It has the trach collar on there and also it had trach ties and also it has these 4x4s. So we're going to be needing suction and also we're going to be needing oxygen. So whenever we suction someone via trach, we make sure we pre-oxygenate them to 100%. Sometimes it's a flow-by trach collar, or you might have to give them some breaths from the ambu bag. We do that for at least 30 seconds prior. So I'm going to turn everything on. So the ambu bag, the oxygen, I'm turning it up to 15 liters. You can hear that flowing oxygen. I place that by the head of the patient's bed. My next thing I want to make sure I'm turning on and is working is our suction. Turning it on to regular suction. For an adult, making sure it's no more than 150. In adolescents, pediatrics is less than 125. In neonates, infants are less than 100 on your suction. So I'm kind of testing it to make sure that I'm not going above where an adult should be, because you don't want to cause trauma. Okay, that's good. So I'm also going to lay that right by my patient's head as well. So I'm going to go ahead and get everything started. I'm going to lay the blue pad across my patient's chest. I have already done a respiratory assessment on my patient to make sure that we needing to be suctioned. I'm going to put the cleaning supplies off of my table. All right, I'm going to put my goggles on. So what's on my table is my sterile saline. Whenever you're adding something to the sterile fill, especially sterile saline, you want to make sure that it's not expired, that it's intact, it looks good, okay? Here is my inner cannula as well, and here is my trach kit, my suctioning kit. I'm going to go ahead and remove this from the packaging. I'm going to get my boat out to make sure that I do not touch the inside of my boat, okay? You can go ahead and add your sterile water, sterile saline to this. Make sure it's not expired. You lip it once into the trash can, and then you pour it into your sterile container, making sure you don't splash anything, okay? All right. You can go ahead and open up your sterile field. You want to make sure that you're opening it to the point where you see your gloves, but don't put your gloves on just yet, okay? I'm going to go ahead and open up my inner cannula, making sure it stays on that little sterile fill that's in there. Okay. And I'm going to do my other gloves. Okay. Pinch and scoop. Step away. And now I'm going to scoop. I'm not worried about my trash. Making sure my gloves are fit and they're good. Don't worry about my trash. I'm going to go ahead and remove these sterile gloves. They won't need them. I'm going to pick up my sterile catheter, suction catheter that is in here. Okay. I'm going to wind it in my dominant hand. I am right-handed. Sorry. I am right-handed. So I'm going to have it in my right hand. I'm going to leave the piggy tail out so I can connect it with my suction. So now I'm going to create a dirty hand and a sterile hand. So when I pick up this, I have created a dirty hand. I'm going to connect it, making sure I do not touch. Okay, I did not touch anything. I'm going to pre-oxygenate my patient for 30 seconds. Okay, and then now I'm going to lubricate before I go into suction. Okay, you ready? 1, 2, 3, thumbs up. Go straight down. Once the patient coughs, that's when you apply suction and you withdraw in a circular motion. You do not suction longer than 15 seconds. And if you need to have another pass suctioning, you need to make sure you wait 30 seconds between each pass. So we can go again. Okay, go straight down. Thumb up. And they're coughing, and now I am pulsing my suction as I come out. Okay, that part of the thing is done. So now you still have a dirty hand and you have a sterile hand. I'm going to take my dirty hand and take out the old cannula. Okay, get my sterile one and put that into my patient at a 9 o'clock. And there we go. Okay, now my gloves can be regular gloves now. So now I can just clean. I'm going to take out the old dressing. I can change out my water to fresh water. Okay, I'm going to open up my sterile Q-tips and I'm going to be cleaning around my stoma. Well, I'm checking for any type of drainage, crusties, any type of an infection all the way around the stoma. The stoma is the opening of the skin where the trach goes in. Okay, we're cleaning it. Also, before I clean, I'd also do another repeat respiratory assessment to make sure that my patient is doing okay and not need to have any more interventions. And how you would know that is their respiratory rate, their pulse ox levels, making sure they're not in any type of respiratory distress. Okay, now you can do this either way. Once you clean, you assess your site, you can go ahead and change the trach ties. We have another person here with you holding the faceplate, or you can go ahead and put on the new tracheostomy drain sponge. So what I'm going to do is I'm going to go ahead and take off the old trach tie, and I have another person here helping me hold it. Because we want to make sure they're in place because we want to make sure they're not going to cough and it's not going to go flying across the room. So I can go ahead and put on my other trach tie, my new one, on my patient. And when you get done suctioning, if your patient happens to be on oxygen, like they're just on regular, like 1 to 2 liters, make sure you apply it back after you do your suctioning in your trachea. Make sure your patient is back on the oxygen in which they are being ordered to get. Okay, we're good. Thank you. And then we can put our trachs, our sponge underneath it. All right. You want to make sure that you can fit at least one finger underneath your trach ties. You don't want it too tight. Okay. And I'm just going to slide this right underneath. Right underneath. Make a nice pretty bow. So we want to make sure that we're protecting the skin of any type of drainage. We don't want drainage sitting on the skin and causing breakdown even further. Other than that, making sure I can do one finger underneath there looks good. Also, when I was changing out the trach ties, make sure I note the back of the skin, the neck, to make sure there's no breakdown as well, because those can tend to kind of rub. Okay. All right, so that is it. I've already repeat my respiratory assessment. Patient's doing good. No concerns. I'm going to clean up my mess. I'm going to document anything that I am concerned about, do my finishing skills, call the doctor if I'm concerned about anything that happened during the cleaning or suctioning. We're going to lower a patient back down, clean them up off the bed, and go and document and call the doctor if we need to.